Where else can someone who's homeless go to receive $1 million smile?
I don't know where I would have gone without them.
It hurts when you can't afford health care. If it wasn't for Care Alliance, I might be dead.
My prayers were answered. This is where I am supposed to be.
If you could build 1,000 more Care Alliances, this country would be a much better place.
The staff at Care Alliance is more than just my doctors and nurses. They are my friends and they are my family.
They gave me health, hope, and more. I love you, and thank you, Care Alliance.
All right, what motivated the Partnership for Collaboration?
Okay, the motivation really started with us receiving federal funding to provide services to those who live in public housing or near public housing. As a result of that, we're the recipient of Section 330I grant. And as a result, we made a conscious decision to provide the residents in public housing healthcare services, i.e. medical, dental, behavioral health, now substance abuse, pharmacy, and all related ancillary services. We know very well, based upon business studies and statistics, that there is a disproportionate health disparities among residents of public housing. And as a primary care provider, we decided to make the appropriate intervention. So we are in 2 of the public housing sites plus 1 in their campus, which is the biggest 30,000 square foot facility recently constructed within a year and a half. Now have a comprehensive services right on their campus within every walking distance from the existing public health housing.
What immediate benefits have you seen as a result of your partnership?
Oh, numerous benefits that we've seen, but the primary or the major one is now the residents of this housing authority are able to access healthcare services. They're able to get medical services, and under medical we have prenatal, pediatrics, women's health, adult care. They're able to access dental services in all our public housing facilities and beyond. We have dental clinics in them that provide services from basic cleaning all the way to oral surgery. They're able to access pharmacy, so they do not have to take transportation or worry about the barriers of transportation, and able to get their medicine once they see our doctors. So the immediate benefit is the easy access to our clinics to be able to access healthcare services. As a result, we are making the residents healthier, and by default the community as a whole. That is the major benefit, but there are some transient benefits that go along with that. We are able to employ some of the residents, so we are giving as much as $6.4 million in community benefit to wherever we provide services, which is primarily in these public housing units.
All right. What are some of the challenges and strengths of the partnership?
Well, we as an organization have made a strategic decision that we really don't have challenges, we have opportunities. So to answer your question, what are some of the opportunities and then the strength of this relationship? I start with the strength of this relationship. The strength is the transparency that we've created. We're able to communicate openly with the housing authority leadership, and then from the leadership all the way to the residents to engage them and to give us the appropriate feedback so we could improve our services. Some of the strengths have been by us collaborating, we have been able to present at their national conferences. The recent one was when we were in New Orleans, that presented in front of NARO, one of their National Association of Housing and Redevelopment organizations, a huge conference that represented about effective collaborations and strategies working with the housing authority. So we continue to garner respect because of our relationship with the housing authority. What are some of the opportunities? The opportunities is more so about community engagement. How do you engage these numerous residents to utilize your services? Yes, you are right there at their doorstep. However, they have established providers that they've been going to before you built your new facility or before you came to their resident. So the opportunity is to increase the marketing efforts to reach out to them, saying that yes, we have all these qualified physicians and clinicians, dentists, hygienists, mid-levels. Come to us, we will provide you with high quality services. So that's really the opportunity for improvement. And then also to announce the presence of the organization in their residents.